program is brought to you in association with First National Bank of Botswana.
FNB, how can we help you?
The current coronavirus pandemic has cracked open a lot of insecurities across various spheres around the world, especially in the corporate space with regards to job security. Hundreds of thousands of people continue to lose jobs during this time. While others are still employed, they suffer from so much anguish, wondering if they will be next or if they are good enough to stay in the company. Others simply cannot cope at all, which may lead to even bigger mental health problems such as depression and diminished self-esteem. According to the Pan American Office, 1 in every 5 people suffers from a mental health condition, with depression being the most prevalent, with over 300 million cases globally. With these statistics, it goes without saying that depression at the workplace is one of the leading causes of lost productivity, sick leave and premature retirement. But these aforementioned issues are only a handful of the mental health problems that many people face at their workplace as a result of ongoing issues in their lives that they find difficult to deal with. On this segment of First Issues, we intend to have a series on depression, self-esteem, grief and various coping mechanisms that one can employ to get a better handle on their mental health. We have here therapist at the Botswana Network for Mental Health, Kutlwano Muthudi, to talk about why conversations around mental health have become important, especially now. Kutlwano, thank you so much for coming here on First Issues. We're talking about mental health, and what we want to start off with is addressing why it is becoming so important, especially in today's world, to have more conversations around mental health.
I believe that it could be due to personal experiences, but people are starting to realize that mental health is really something that's important for us to talk about. And you know that these awareness campaigns that have been designed, we had World Bipolar Day. This month we're focusing on stress awareness, and these are some of the things that have been put into place to kind of spread the word about mental health and what it is exactly. And with the rise of these awareness campaigns, I think a lot of us, through hearing about it and understanding what mental health is, as well as some of the mental health challenges, we're able to reflect on our lives and our experiences and notice, okay, maybe last month as I was going through this, it's called depression. Right? And they start to realize that maybe they've been facing these mental health challenges all along, but they have been either brushing them off or using negative coping mechanisms to get through them. But with the rise in awareness and through self-introspection, they learned to realize the importance of mental health.
We spend a lot of our time at work. This is especially for people who work. So do you think that most workspaces offer positive mental health experiences?
I'm not quite sure about the statistics in terms of how many employers or organizations actually seek mental health support for their employees. But I do know for sure that some mental health facilities that provide mental health have a workplace mental health program in store. For example, at Botswana Network for Mental Health, we do provide mental health services, particularly programmed for the workplace. And also, just from word of mouth, I believe that a lot of companies are engaging in providing mental health services, and they have actually included mental health in their medical aid package, which makes it easier for their employers to access mental health services.
We're seeing an increase in mental health problems being reported on various media outlets. Why is this the case? Do you think it is simply because we have access to all of this information, or it is because people are having the conversations that we've just been talking about?
I believe that it could be a combination of a number of things. One, social media platforms are broadening on their own. So ultimately, the topics that are discussed on social media would also kind of broaden, right? We're more aware of it now. And then it could also be because of the level of awareness on mental health issues that have been going across social media platforms that have also encouraged people to self-introspect and to really think about the challenges that they have been facing and how their mental health is currently structured, right? Yeah.
As a therapist, do you think that people are taking advantage of the various mental health support services that are available, albeit them being short? Or do you think they're aware but not taking them up?
There's still a lot of work that needs to be done in terms of people utilizing the mental health services that are available. Even though has been a rise in terms of the number of people who seek mental health, I believe that we still need to work on the commitment that we have on our mental health. For example, what I've noticed is that a lot of people seek therapy when they are at their lowest, right? When they're going through a crisis. And then once they have found somebody that they want to talk to, a therapist or a mental health provider, what they do is they offload, they'll talk about it, and that on its own honestly has a tremendous impact on how the person feels. So because they have offloaded what has been weighing on their shoulders, I think a lot of us tend to think that we're okay now. So we don't take the next steps, which is continuing therapy and, going on to understanding underlying factors that that we have developed, or negative thinking patterns or belief patterns that have developed through the years. So we don't go to the extent of unearthing the root cause of our mental health challenges, but just from the moment we start feeling better, we retreat from the mental health services. So that's what I've noticed. We tend to seek services when we're in a critical stage, but then once we feel like, okay, no, I'm okay now, we back away from mental health.